Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be discussing the anterior cruciate ligament, or ACL, and the posterior cruciate ligament, or PCL, and the common mechanism of injury associated with tears to these ligaments. So first, let's discuss the overview of these two ligaments. The ACL and PCL are the primary stabilizers of the knee joint. They work to restrict excessive anterior and posterior tibial movements on the femur. In addition to this, they restrict excessive internal and external rotation, as well as valgus and varus movements of the tibia on the femur. Both the ACL and the PCL are relaxed during external rotation of the tibia or lateral rotation, while during medial rotation of the tibia or internal rotation, both the ACL and PCL are taut. So first, I will dive into reviewing the ACL, and then I will pass it over to David for him to review the PCL. So the ACL extends superiorly, posteriorly, and laterally while twisting on itself as it extends from the tibia to the femur. So when it comes to the function of the ACL, it prevents anterior translation of the tibia on the femur. So that is very important. Again, the ACL prevents anterior translation of the tibia on the femur. It also checks external rotation of the tibia during flexion. The ACL is under the least amount of stress during knee flexion between 30 and 60 degrees. An injury to the ACL is most commonly seen in sports-related injuries. They happen most often due to a sudden deceleration, an abrupt change in direction, or the foot being fixed or planted on the ground. These are considered non-contact injuries. The ACL can also be injured when excessive lateral force is applied to the lateral aspect of the knee on a fixed or planted foot, which would be considered a contact injury. During a twisting injury, the knee is extended and the femur is rotated externally on a fixed tibia. In comparison, when participating in the same sports, women are more likely to have an ACL injury compared to men. It's also important to know the signs and symptoms of an ACL injury. The individual will have a distinct pop or giving out, which is associated with pain, knee joint instability, and an inability to bear weight on the leg. They may also present with acute hemarthrosis or quadriceps atrophy.
To be honest with you, there's so much more to be discussed right now. That was the ACL. So now let's break down the PCL. The PCL extends superiorly, anteriorly, and medially from the tibia to the femur. The PCL is 50% thicker than the ACL and has twice the tensile strength. It functions to prevent posterior translation of the tibia on the femur. It can also check on extension and hyperextension. It will restrict internal rotation of the tibia on the femur and helps to prevent posteromedial instability of the knee. The PCL assists with rolling and gliding mechanisms of the knee joint. The PCL also has some secondary functions. It will restrict external rotation of the tibia on the femur at 90 degrees of flexion, and also restrict valgus and varus forces on the knee joint after the collateral ligaments have failed. A significant amount of force is needed in order to tear the PCL. It is usually as a result of severe contact injury due to traumatic events, such as a dashboard injury during a motor vehicle accident. A patient may also experience a PCL injury during a fall on the anterior aspect of the proximal end of the lower leg with a flexed knee, or hyperflexion or hyperextension of the knee. Let's go through those important signs and symptoms now. You're going to hear a pop during the injury. You'll have vague symptoms of unsteadiness or discomfort. And during the acute injuries, you'll note moderate effusion. You'll also have posterior knee pain and pain with kneeling. With the severe tears, you'll see also possibly more knee instability, which, if present, the patient may be complaining of their knee giving out or giving away. Now that you understand the common mechanisms of injury for an ACL or PCL tear, here's a Chinese proverb. The best time to plant a tree was 20 years ago. The second best time is now. So, final frontier warriors, start planting, plant your trees, and start going after that dream. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.